Hey, it's Jessica DaMassa with WTF Health. I'm here at Webit in Sofia, Bulgaria, and joining me right now, I have Sandeep Bansal. He is the CEO of Medic Bleep. And so what is Medic Bleep? What are you guys doing? What a cute name, by the way. It's fun to say bleep.
Thank you so much. So we're replacing the current paging systems in healthcare, services. Communications is really broken in the whole of healthcare at the moment, and we're bringing about an instant communication solution to replace current outdated synchronous communication methods.
What's wrong with the paging system?
It's been around for 70 years, so actually it's been really robust and really good, so credit to it.
Okay.
But what's wrong with it now? So we get in the NHS about a billion internal phone calls a year.
Oh my God.
Out of that, about 23% are just to find the right number for someone.
No, you're kidding.
Genuinely.
Oh my gosh.
230 million just to find the right number. 32% of the calls are missed. 320 million calls missed. Right?
Okay, so that's like half right there of all of the calls. I'm either calling to get a number that's not right, and then when I call the number that is right, somebody's not answering it.
Yeah, spot on. And healthcare is very asynchronous. So if I'm a doctor, I could be by the bedside. I'm not fixed to my desk, so no landlines. And you don't know what you could be doing at any given point in time.
Yeah.
So with that, synchronous communication just doesn't work anymore. It's just not fit for purpose now.
Okay.
Yeah.
So how are you guys replacing it? What are you doing?
It's an instant communication solution that sits on workers, healthcare professionals' own devices.
Okay.
It can sit on the organization's devices as well.
So is it like an app?
Yeah, it's an app-based and web-based kind of communication technology. Very much like WhatsApp, but of course catered around the professionals. So we don't need to know people's phone numbers. We typically don't in an organization. You just need to know you need to call the surgical reg on call. So you find that in the directory and away you go. You just message them or call them directly from there.
Okay, so you can actually, if I'm understanding this right, you can search it by like, not necessarily who as a person, but who in a role.
Absolutely.
Okay.
Who in a role, which department you might want to reach out to, by email address or even by the name if you know it.
All right, so how are you guys running this right now? Are you piloting this? Where have you been piloting it?
Yeah. So we've piloted it already at West Suffolk Hospital in the NHS, and our peer review paper was published on this.
Right, so what's your data then? Tell me.
Yeah, absolutely. So every single nurse, every single shift saves 21 minutes.
Saves 21 minutes.
And every junior doctor saves 48 minutes every single shift.
How did you quantify that?
Yeah, so we did something called a time motion analysis,
Okay.
which, to put it bluntly, it's a very painstaking kind of process where we had medical students and nurses follow around doctors and nurses and timestamp literally when they completed tasks before and after implementation. It was painstaking.
Oh, it sounds like it was painstaking. You need to disrupt the way that you're doing your own trials here.
It's true, but unfortunately in healthcare, those are sometimes the only way to get the data because data sets aren't connected, right? So there's another issue in healthcare.
Absolutely, interoperability. Okay, so let me ask you this then. So Medic Bleep as a company, what are you guys up to? Are you raising funds? Are you still in a phase? I mean, you rolled out in one hospital. So what's the plan for growth here? Give me a little bit of the sense of the business side here.
Yeah, sure. So we were very fortunate and got highlighted by Matt Hancock, who's the Secretary of State for Health back in the UK. And off the back of that, data that we produced, he's purged the pager, which is no more pagers in the NHS in the next 3 years. So since that was done in February, we've had 150 hospitals reach out to us.
Wow.
Not only in the UK, but in Australia, whole healthcare systems there, and the UAE, an organisation who caters for about 20 million patients, has reached out to us due to that.
Okay. And so are you raising money or what are you guys doing?
Yeah, we're
Always raising money.
Well, sadly, we'd like not to raise money, but because of that demand, we're having to raise money, to service that demand.
So is this your A round or?
This will be my A round.
This will be your A. Okay, and how big are you as a company? How many people?
Yeah, we're 30 strong.
Oh, wow. Very good. Awesome. Cool. Well, best of luck to you. We look forward to hearing what happens here and that no more pagers in 3 years goal. We'll see if that's attained and you're the replacement. We'll see.
Thank you so much.
Awesome. No, thanks for chatting. I'm Jessica DaMassa with WTF Health here at Sofia, Bulgaria at Webit. Thanks so much for joining us.
Thank you.